Hi everybody, Dr. Sunil Dand, internal medicine physician. 3 golden communication tips for busy physicians. Being a doctor is one of the most hectic jobs out there. I know that when I'm working in the hospital, there's always 101 things to do at any one moment, and that is the nature of the job. However, as doctors, we always have to remember the importance of good communication skills with our patients. And I would say this could apply to any clinician out there who interacts with patients in healthcare. Here are 3 tips then for maintaining good communication. And actually, this could even apply to any profession where you're dealing with people. But obviously, I'm going to focus on being a doctor. Number 1, listen. This sounds so basic, but it is so absolutely fundamental to the practice of good medicine. Research shows that the typical doctor interrupts their patient within a few seconds of them speaking. We must allow our patients adequate time to tell us what's on their mind. And in fact, many of my professors in medical school used to say the patient will lead you to the diagnosis if you let them speak, and that is very true. As the saying goes, if speaking is silver, then listening is gold. And when it comes to the doctor's turn to speak, remember some other fundamentals as well, such as always speaking slowly and clearly, avoiding using excessive medical jargon. That's a big mistake that some clinicians make. Imagine, in fact, that you're talking to a family member of yours who is not trained in medicine, and also asking open-ended questions. These are all core important parts of good communication between doctor and patient. Number 2, watch your body language, especially avoiding appearing in a hurry. This can be difficult to do because every doctor is in a hurry. That's a reality of medicine at the front lines. But it's important that we don't show our patients that. And in fact, human beings in general are very good at perceiving if the person in front of them is looking flustered or in a hurry. And doctors should never appear that way. Try to always appear calm, and some tips to do this include, before going in the room, take a couple of deep breaths, make sure you've reset your mind completely from whatever has happened before, and ensure that you're going to be fully present during the encounter. Sit down, maintain good eye contact when you're talking, and avoid doing things such as turning around, typing, or clicking away, looking at another screen. These are all important things to remember during any patient encounter. Over the last 18 months, masks have obviously changed a lot in that we can't observe facial expressions as easily in others, and that's a shame when it comes to good communication. Nevertheless, these same rules still apply, even wearing a mask, of watching your body language and especially not appearing flustered or in a hurry. Number 3, never leave the room without asking if the patient has any questions or concerns. I'm often very surprised with how often this happens, but a doctor should never leave the room without firstly ensuring that the patient understands everything that has occurred during the encounter and everything that's been said, and then asking if the patient has any questions or concerns. We are dealing with very important issues here, to do with the patient's health, to do with their body, frequently matters of life and death. And patients, as far as I'm concerned, should have questions. That's completely normal. And it is our job as doctors to answer these patiently and with compassion and empathy. Sadly, lots of healthcare systems across the world are facing extreme pressures, and many are on the verge of complete collapse. There are so many other factors involved in making the practice of medicine difficult, to the point where doctors can't spend adequate time with their patients, whether that be the encroachment of third parties, insurance companies, big pharma, technology companies, other business interests, other hidden agendas, or even too much government bureaucracy. All of these things are making the practice of medicine difficult, and it's a terrific shame. What we have to remember in all of this, because the one person that's often forgotten with all of these different factors involved, is the patient. And that unique individual human being in front of every doctor must remain the core and in the middle of all healthcare. And as doctors, we do a very important job, and we must remember the importance of good communication with our patients, because that is something that we are in control of. Thanks everyone for listening. Dr. Sunil Dand. Follow me on YouTube and Facebook, MedStoic Lifestyle Medicine. We'll speak again very soon.